Well, good afternoon, everyone, and welcome to GAHE's Leadership Series webinar. I'm Bruce Lloyd, GAHE's Executive Director, and it's my pleasure to introduce Trent Lind, who is CEO of Piedmont Eastside. Trent?
Hey, thanks, Bruce, and thank you all for being on Zoom today. We're excited to have a tremendous speaker with us today, Ron Lavater, CEO of International Hospital Federation, based in Geneva, Switzerland. It's a little later in the day for Ron, so we appreciate him being part of this this afternoon or this evening, depending on what part of the world you're in. And just really a fascinating topic, leadership in international healthcare. And we just had a chance to sidebar a little bit, just kind of what we're seeing across the world today when it comes to COVID. And so certainly just a lens that we don't always here within the U.S. get a chance to see what's going on across the international landscape. And as you recall, we've had another international speaker earlier in one of our prior sessions a couple months back. So we're really excited to keep the international theme going and to have really a big time thought leader in this space with Ron. So welcome, Ron. Excited to have you. Before we get started, I want to spend a little time with some other introductions and thank yous. We always say we aren't able to put on amazing sessions like today's without our sponsors. And you can see here our platinum sponsor, Wellstar, always there to support in a big way. And we really appreciate all that Wellstar does to help us put a session like today's on. Our gold level sponsors, Piedmont Healthcare, Metro Atlanta Ambulance Service, Vocera, and Sound Physicians. Thank you to our gold sponsors. And then our silver sponsors, DT Spade and SSR. Again, tremendous. Thank you for all you do to help fulfill our mission here at GAHE. Upcoming events, I won't go through these in detail, but you can see across the board here continuing in September, as well as our October events. We've got a full slate, and we're really excited to continue to offer amazing virtual opportunities. We wish, again, we could be in person, but as things go today, we're going to remain in a virtual world here for the remainder of this year at a minimum, but really appreciate the engagement and involvement. We continue to have tremendous attendance, and we continue to have tremendous engagement, and certainly the feedback we get has been fantastic. So please make sure you go out online and register for these future events. And you can go to gahe.org to do so. Stay connected, obviously through our website, but Facebook, LinkedIn, GAHE, Connect on Twitter, just different outlets that you have there to stay connected and stay informed. I always give a shout out to Seppi Browning here, who helps to lead our communication efforts, and really tremendous work that's being done by that committee. But please stay connected. And you can stay connected in a deeper way, and that's by getting involved in our committees. This is your chance to not only give back to GAHE and give back to ACHE, but certainly a chance where you can get more connected with your colleagues across the state of Georgia and beyond. If you have an interest in any of these committees, communications, career development, fellowship advancement, member growth and satisfaction, diversity and inclusion, our physician executive group, programs committee, and sponsorship committee, all great ways, again, to give back, but also great ways to broaden your network. Today's event, 1 hour of qualified education. After this session wraps up, please make sure you go out to My ACHE and get credit for today's qualified education hour. All right, without further ado, we've got Ron Lavater here with us today. Ron, obviously a fellow in the college, and so certainly proud of the work he's doing there. I think we were sharing before, because I'm in the same boat, Ron. I've also got to renew my fellowship this year, so we're both going to take advantage of these credits today. But you can see Ron's background. Ron asked me not to go into too much detail, because he'll share a bit with us here in a moment. But 25 years of healthcare experience. As in healthcare, our paths crossed quite a bit, and Ron and I almost crossed paths from our relationship with his relationship with Well Street and my involvement today with Piedmont. But you can see just a really impressive background, especially the work he's done in the international setting, and that's really the backdrop for today's discussion. So I want to officially welcome Ron and in advance thank him for giving us his time and his insights today. Ron, take it away.
Thank you, Trent. Really appreciate that. Now, in today's world, the next thing a speaker does is say, hang on, I'm going to share my slides. So that's what we're going to do. All right. So Trent, thank you. Thank you to the Georgia Association of Healthcare Leaders. I think this is really a nice opportunity for me. Bruce helped organize this and connected with me. And then I think Larry was a little bit of the ringleader to bring me in. I will say that Larry also knows Linda Clark, who you heard from a couple months ago. She's a friend and a colleague, and is actually running the hospital that I ran for a number of years. So I'm gonna start today by saying that this lapel pin says the International Hospital Federation, and I don't have my ACHE pin, but I did find this in my office because IHF and the Internet and ACHE have been members and collaborators for a long time. So I do have this. I was thinking about trying to wear it as a medallion, but I couldn't find anything to hook it on. So I just want to let you know that I am a proud member of ACHE, and I was figuring it out. I joined as a student in 1992. So close to 30 years I joined, and then became a fellow. If it was, my memory was either 02 or 03. I can't remember exactly when I became a fellow. So let's go through my presentation here. So I'll tell you a little bit about the International Hospital Federation, what it is and what we do. I'll share a little bit about my background. I think there'll be some interest just because it's a little bit unusual. And then, then I had to do a little bit of learning lessons. So I put together some material around leadership principles. We'll talk about, what you need to do or what you need to think about if you want to work internationally. And then we'll open it to questions. I'm going to be like a good American. I'm going to talk fast, but we'll leave a lot of time for questions. So let's start. The International Hospital Federation is an organization that has a strong vision and mission. I will not read you these, but I want to let you know that we've been around a long time, and we do have both a very strong vision and mission, and everything that we do kind of falls through into each one of these. So who we are, the International Hospital Federation, IHF, is a global not-for-profit, non-governmental membership organization. Oof, that's a big mouthful. We've been around for more than 90 years. So it's been established since 1929. We're headquartered in Geneva. So I'm calling you from Geneva today. It's 6 o'clock or 8 minutes after 6 here in Geneva. And what we are is a global association of country-level hospital associations. So if you think about it this way, the American Hospital Association is a member, the Canadian Hospital Association, the Japanese Hospital Association, the Korean Hospital Association, etc. Then we also have other partners like the American College of Healthcare Executives, as well as other entities across the globe. And if you put it all together, we cover about 50 countries. There's 212 countries, according to the United Nations. We cover about 50 of those countries through 100 different organizations. And if you look at our organizations, underneath them are the hospitals and the health delivery systems. And if you do some math, it's about 20,000 hospitals or healthcare organizations that are part of our membership. We're a membership organization, so our membership fees pay the salaries of the staff and allow us to do our work. So we're based in Geneva. I'm going to spend just a minute about Geneva. I think it's kind of interesting and cool. If you haven't been here, you need to come visit. But the reason why Geneva is interesting and cool is because, I got to get my numbers. I got to read this here for you. We have over 750 NGOs that are based here in Geneva. We have 39 international institutions, and an international institution would be like the WHO, the World Health Organization, the WTO, the World Trade Organization, et cetera. So there's 39 major global organizations here, including the United Nations. So the largest United Nations post outside of New York here's in Geneva. Because of that, we have 177 member state embassies. So we have embassies, even though Geneva is not the capital of Switzerland, they have embassies. These embassies house the officers or the ambassadors and staff to support the work at the UN and other organizations. So we are definitely the hubbub of international life. Lots of healthcare, like the Global Fund, like the International Committee on the Red Cross, lots of those types of activities here. We also, you remember, we hosted Biden and Putin earlier this year. So it's definitely an interesting place to live, very multicultural and kind of facing the world. So IHF, so the International Hospital Federation, what do we do? I like to keep things simple. And so the team and I boiled it down to 8 boxes or 8 main activities. And I'll go through a little bit of my background, but I've been here less than a year. So I joined the IHF late last year. I had a great transition with my predecessor for 2 months, the CEO for 2 months. He was the CEO for 12 years, so it was good to have that institutional knowledge and have that transfer over. And then I became CEO in December of last year. So what do we do? Well, we do these 8 things. I'm gonna have an advertisement slide on the World Hospital Congress, so I'll skip that. We have awards. So every year we go out to the world and ask hospitals to submit to our awards program, and we've been very successful. We just finished up this batch. It ties to the World Hospital Congress, which is in November. That happens annually. And we had 250 entries from around the globe, representing 38 different countries. So 38 different countries submitted projects or those hospitals in those, and we have the IHF awards. We have special interest groups, which I'll talk about. We have 3 special interest groups. We do advocacy work on behalf of hospitals, usually in partnership with organizations like the World Medical Association or the International Council of Nursing, which represents nurses across the globe. We have a young executive leadership program. And one of your colleagues from Atlanta is in the program, John from Wellstar. And here we have 32 younger executives. They're not junior people, they're executives, but they're younger in their career. And these 32 folks that represent from 20 different countries are working through this year in small groups on different topics. They also have master classes through the year, so we have international speakers, and it's really a great program. And then they present at the World Hospital Congress. We have Association Leaders Circle, we have Women in Leadership Forum, and then we do knowledge sharing or knowledge exchange and knowledge sharing events. So that's what we do. That's what IHF does. So let me talk briefly about the special interest groups, because I think this is important and probably resonates with some of you. So when I came here to IHF, I wanted to go deeper into topics and not try to tackle every topic, because you can't do that with IHF. We only have 10 staff people, and you can't provide really good thought leadership work on too many items. So we picked 3 special interest groups. The first is telehealth, and really navigating the future for hospitals and around telehealth. So we formed the special interest group. We have people from across the globe, some coming from industry, some coming from the hospitals, and we're getting together and we're producing work products that will hopefully raise the bar and give opportunities for examples across the globe on how hospitals or health systems are navigating the future of telehealth in their hospitals. The second special interest group is harnessing big data. As you know, big data, I'm using AI to manage my hospital. Well, what does that really mean? And so what we did was form the special interest group. We were lucky to partner with Vizient, that has a very deep knowledge in harnessing big data. And we're going through the opportunity with our special interest group steering committee to look at programs that will hopefully help hospital leaders across the globe get some examples on how to harness big data and analytics. The last is sustainability, or leadership for sustainability. And if you think about it, I ran hospitals for close to 20 years, and hospital administrators, hospital CEOs can do a lot of things. Leading around sustainability hasn't been a major focus for them. It just hasn't been, but it is going to be. If it's not today, it will be even more and more in the future. And so what IHF wants to do is fill a little bit of that knowledge gap. And so we're looking at not the technical aspects of doing carbon reduction at your hospital or sustainability projects, but really the leadership component. If you're leading a hospital, what do you really need to know to talk to your board, to talk to your employees about your sustainability agenda? Those are the 3 special interest groups for IHF. They'll go for multiple of years, and we'll have different knowledge sharing activities during that time. Here's an example of one. So this is the advertisement portion. So we have an event happening next week where we've brought together leaders of sustainability programs from Japan, the UK, the US, France, Germany, and Taiwan. They're all going to talk about their specific projects, some on food waste reduction, some on energy consumption, all around the topic of becoming a greener hospital. And so this is a practical example of what I mean by knowledge exchange. So we put these together. We get the speakers, we develop the programs, we bring people together for these types of events. And the slide on the World Hospital Congress. So we're on our 44th year, and this is being held in Barcelona, Spain, the 8th through the 11th of November. It is an opportunity for usually, without COVID times, between 1,000 and 1,500 hospital executives from around the globe getting together for a 3-day event. This year, we're going to do it as a hybrid event, so we'll have the virtual option. And right now, the registrations look about 650 folks. So we think we'll get to close to 1,000 people registered. And that's not bad in today's world with congresses. So this is a great event. If you ever want to, put your toe in the water internationally, look for the International Hospital Federation's World Hospital Congress coming to you in November. Next year is in Dubai. So I mentioned a little bit about my background as we talked about IHF, but let me give you some of the boring details. And I do this to give you at least one example of a kind of a career path, but also give you where I'm coming from as a professional. So knowing a little bit about my background will help you also understand kind of how I, look and view things in the world. So 30 years of healthcare experience. In the US, I started my career in the payer side, Blue Cross Blue Shield of Florida. Great opportunity. I was an analyst. I was not an executive, but it was just a really great foundation to understand healthcare in the United States from the payer side. Then I was lucky enough to join HCA and spent more than a decade with them, moving in roles as an associate administrator, as a chief operating officer of a small hospital, chief operating officer of a large hospital, and then a CEO of a hospital. So I went through that path for quite a bit. My wife and I both turned 40, and we decided that there might be something else for us than to work in the United States. And I'll leave that as a teaser for the part 1 of the international adventure. But I did come back to Atlanta, and let me mention my friends at Piedmont Urgent Care, great company. I was really honored to be the CEO for 2.5 years for Well Street, and it also taught me a lot about outpatient and ambulatory care and partnering with health systems. And then it brings me back to adventure part 2. So let's talk about the international adventures and the in and outs of my career here. So I love this. You're going to get tired of looking at Ron walk across the globe, but I figured now you have a visual aid. But the first international assignment coming from HCA was with Johns Hopkins International. Johns Hopkins International is part of Johns Hopkins, which you'll know out of Baltimore. And like several other US institutions, they had an international arm. They have an international arm. And I was fortunate enough to be hired as the CEO of Corniche Hospital. And it was a really interesting journey for my wife and I. So we went out there and looked at Abu Dhabi is where it is based. We went out there, I did the interview with the client. It was a managed hospital. So Johns Hopkins managed a government hospital. And so I needed to meet with the government officials and all that kind of activity before I was offered the job. And, you know, my wife and I said, this is cool, this is interesting. And most international assignments, not all, but most international assignments usually have a time limit. So it's usually 2 years or 3 years, the contract. And so with Hopkins, it was a 2-year contract. So I said to my wife, and my wife said to me, we can do anything for 2 years, take the job if it's offered. So I took the job, it was offered. And we moved to Abu Dhabi. And the 2 years actually turned into 6 with Hopkins, running Corniche Hospital. It was a fantastic experience of living abroad, running a hospital, providing leadership to a country which is maturing, but also so having an impact, maybe a little bit greater than you would in the US, which has a very mature system, but just really having a great life experience as well. As you heard from Linda, if you listened to Linda a couple of months ago, Abu Dhabi's position where you can fly within 4 hours to places around the globe where, you know, there's like 25% of the world's population is within a 4-hour flight of Abu Dhabi. It's just a fabulous place to be from a life balance standpoint. So I finished up my assignment with Corniche. The contract with Hopkins and the government ended. We turned the hospital over through a lot of fanfare. Linda was the CEO that received it. She was actually an employee. She's an employee of the government. And we also trained up a deputy CEO, which was a local Emirati person. And then I was like, okay, what's next? Well, because I had this international experience, I understood it. My wife was having a good time. She was working for NYU in Abu Dhabi. So yes, New York University has a campus in Abu Dhabi. A company called Al Noor Hospitals Group, which is a publicly listed company, came knocking and they needed a chief exec. And it was like, let's do it. We didn't intend to, but then we stayed another 2 years in Abu Dhabi. And I picked it, or I was fortunate to be selected. And what made it very attractive to me, it was running a hospital group. So there was 4 hospitals, but I got the experience of international listed company or a publicly listed company, which was traded on the London Stock Exchange. Great opportunity. We sold the company, so there was a transaction similar to what happened to Trent and everything. We sold our assets, sold our hospitals to a much larger company, and I was part of the deal. So the management team left, which happens a lot, and so it opened up another opportunity. Well, what do you want to do? Do you want to stay international? Do you want to go back to the U.S.? My wife and I decided, hey, let's just go back to the U.S. And it was great, came back, and that's where I worked at Well Street. So I kind of give this because I want to talk about that today you can move back and forth. Because when I do talk to executives, they say, oh, I don't know if I go out internationally, I'll never be able to come back. Well, that's not necessarily true. And I'll give you some helpful hints on what you can do to keep relevant and marketable in the US market, but also international. So after Al Noor sold, I went back to the US and did Well Street. Well Street was a great opportunity for me. We almost tripled the size of the company. The team was great, it was in place. And, you know, COVID hit and we were like, it was good timing. We had signed a couple new deals and we talked to the owners and we said, let's see what we can do differently. And this position came along. And it was an opportunity for my wife and I to go international again, and we went for it. And so we went back, International Experience Adventure Part 2, which is the International Hospital Federation. So that's a little bit about my experience I don't know how interesting it is, but I needed to fill some time because this is the lecture time. This is, yes, I did a little bit of internet search. I talked to a few friends because I did want to give you some leadership principles that were a little bit more meaningful than just maybe my ideas, which I will share. But I went through a bunch of articles, and I wanted to pull out really two of them because I thought they were like super interesting. The first is Harvard Business Review. You can tell both of them are from Harvard Business Review, so I do maybe have a limited library. But the first one, it was super interesting because it talked about leadership competencies. Okay, so this study, they went through this process of talking to 195 global leaders. So these are folks from around the world, 15 different countries. And they asked them to rank and rate 74 leadership competencies, leadership traits. And they did this exercise and they came back with all the data, and then they started to pull out some themes. And those are the 5 themes listed below. And what I found was super interesting is the first one. It wasn't about experience. It was about having, demonstrating ethics and a sense of safety. So creating an environment of trust in your organization. And I thought that was really telling and quite powerful. So I wanted to list that. And then, the others that you will go through, and as leaders in your organizations, you'll recognize these: empowering others to self-organize, fostering a sense of connection and belonging, showing openness to new ideas and fostering, a learning environment, and really kind of nurturing growth of the organization of people. So, I mean, yes, any of the management 101 will come up with this, but the trust one was like super interesting for me because the second article, I highly recommend. It's a quick read, but it really was a kind of a mathematician and neuroscientist coming up with some of the data or the science behind trust and how he saw trust in organizations really help organizations excel. And again, you can read the article. I won't read it to you, but he said, if you want to have a highly successful organization, building that trust is so important. And then he actually gave, which was kind of nice, he actually gave some of the management principles, recognizing excellence, inducing, challenge, stress. And, and hopefully you're doing this in your organizations. I talked to my team about, so we have this World Hospital Congress. We have one big event a year. 30% of our budget comes from the proceeds of this event. So you get it. And so it creates a lot of stress within the organization. And I talked to my team, though small, still super powerful professionals. And I say, it's okay to be stressed. It's okay to feel challenged. It's a matter of how you deal with it and how you work together as a team. And so I don't have to induce stress. We're getting it. But those simple tools really help in my history, which is quite important when you're running an organization. Giving people discretion, allowing job crafting, which is really interesting, where some of the best organizations really allow people to design their own work. Yes, there's certain assignments, certain jobs that have to be done in an organization, but if you really have some creativity with your organization, there's a lot of opportunities for people to really grow and mature as professionals, even within their current role. Share information broadly. You should always never miss an opportunity to communicate with your employees, with your customers, with your board. Intentionally build relationships. That stands for itself. I mean, you put in, you get out what you put in, and if you care about relationships, you have to actually work on it. Facilitate whole person growth, and then show vulnerability. Yes. Especially during these times, I see the hospital leaders across the globe And the ones that I think are the best are the ones that truly admit that they're in uncharted territory, they're uncharted waters. And though they're going to try to lead the organization through it, they do show the vulnerability. So those are two articles. That's the leadership lecture point of my slides. I promise not to bore you with this. I don't pretend to be a professor. I've just been running organizations for a bit. The other thing I came across, which I thought was really interesting, and you probably maybe read it this summer, is Amazon has leadership principles. And if you haven't looked through the 16, they're on their internet or their website. They're actually quite good, regardless of which company you're trying to run, if it's a consumer company or a hospital. And the two that they added, which I think were quite timely and maybe should have been there earlier, was strive to be the Earth's best employer. So not many people who are running organizations, or not many organizations, could talk about trying to be the best on the earth, but Amazon has that type of scope. And then it leads to the next one, is that with great success and scale brings broad responsibility. And really understanding that large companies like Amazon, from a leadership principle, is really putting this in for broader responsibility. So let's go to the next slide. And let me offer some advice, leadership principles, if you want to put it that way, on something that I've had the opportunity to do. Maybe not as many folks in the audience, but this is my experience in entering a company. So I was fortunate to be a CEO with HCA, then one with Hopkins, and then Al Noor and Wells Street. So I've had the opportunity to enter organizations as the chief exec. So I didn't do this in the beginning, but I really thought about it. I had some help, and I really started to think about how I want to enter the organization. And putting some, real energy into it, because I think it's quite important. And so I use this with the IHF board. So it's in the same language and terminology, and I'll go through some of these that I used with my board. So from a governance standpoint, I have 25 bosses that make up my governing council. That's the terminology they use for board. So my governing council is 25 executives, healthcare leaders from across the globe. And all 25 come from 25 different countries. So right there, you can see some of the complexity. Within my governing council is an executive committee, and there's 4 people. And truly the executive committee is the ones that I work most closely with, and talk to on a very regular basis as we run this organization. But so what I did was I came up and I had to speak to the governing council, the board, when I entered in. And I said, look, I have a 100-day plan. And it might be straightforward and obvious, but here are my guiding principles for me as the CEO of this organization, this NGO that's been around for 90 years, right? So I want to be visible. I want to listen, and listen with purpose. I want to spend time with the IHF team, though small, they're doing the work, but also our key members, right? So our membership organization and our partners. I want to share a little bit about my background and my experience so people can understand where I'm coming from, right? They need to know what my perception is, just as important as the next point, which is I have to understand the stakeholders' expectations and where they're coming from. In a lot of ways, the stakeholders have to also understand where I'm coming from. It helps with the relationship. The next was something that I've taken upon. I had a consultant many years ago help me with this, is organizational truth. All right. So when you're in this orientation phase, you're getting data points. You're getting data points from all across the spectrum, right? And these data points should allow you to start to really understand what the organizational truth is. Not necessarily what's out there in the newsletter or the last annual report, but really what's happening in the organization. And sometimes to get that, you have to listen, but you also have to ask pointed questions. And you have to not be afraid to do that. The other one is just, pure good sense, stay connected to your executive committee. For me, that would be my bosses. Under promise, that's hard for leader type A people. We like to come in and promise we're going to fix everything, but here it goes. Don't move quickly, but do move deliberately, and seek to understand first before you seek to solve. Really simple things you guys heard, 100 times already in other lectures, but really powerful, really important, especially as you enter an organization. You really need to understand what's going on. It takes more than one meeting. It takes more than one time thinking about something. But when you do understand it, right, you need to move deliberately. Right. So that was my guiding principles. You can steal these if you'd like. And then the other thing I wanted to list here, because I did have a 3-page plan. I'm not going to bore you with all this, but I did want to list here some of the follow-up. So like a good executive type, you review the mission and vision, the strategy, the systems, the services, the programs, the staff, and the culture, and you kind of make sure it all kind of blends together. And if you don't do that, then you're missing something, and then you really will kind of come later in the organization. You might be there a year or 2 years and say, why am I not being as successful as we want it to be? And you might have to then go backwards and say, well, do I really have the systems and people in place to match the strategy? So you don't want to skip that kind of connectivity on these important things. All right, moving right along. Promise, I think I have 2 more slides, and I'll open it up for the audience participation. I can't see the number of participants if it's going up or going down to measure how successful my little lecture is. So I'll just keep talking. So you want to work internationally. Okay, I'm going to be a biased audience because I'm going to say, if you really want to do it, then do it. You can move from a U.S. career to an international career, and you can come back if you desire to. The best advice I've gotten, and like I like to say, is manage it like a project. Everyone that's listening to me who's a leader is project managing something. If you're managing a hospital, you're managing people, managing projects, but you're project managing, right? That same skill set. Your career, you got to project manage it. Build a plan, work the plan. I know that sounds really simple, but it's actually quite powerful if you do it. The other thing I tell people is, look, you got to have flexibility. And that flexibility is understanding that you may not find the perfect international job right off the bat. You might have to think about your skill set that you can bring to the international market and look for opportunities that may be slightly different than what you originally thought you could do. You might have to become a senior operations officer and not the chief operating officer of an organization to get an international assignment. You might have to work, maybe not in acute care delivery, hospital management, but you might have to go to ambulatory services, et cetera, et cetera. You get the idea. And having that flexibility will allow you to look at the opportunities more broadly. And if you really want to do it, you might do it. The next point, I put it in, I took it out, I put it in, ethnocentrism. So look, we all come with our biases, right? And how we evaluate, other cultures or other systems. And as switched on as you are, as self-aware of you as you might be, you still need to recognize that you still will always have this bias because you're going to use it as the measuring point. And that, I've worked internationally, I've dealt with international people running institutions across the globe, and that's okay. It's okay to have, I say it. So one of my normal days, I didn't say this earlier, but a normal day for me is I roll into the office and I start talking to people in Korea, Japan, Philippines, Indonesia, my members, Australia, the members on that side of the world. As the day progresses and the sun moves, I'm talking to people in Europe and Africa, And then in the late afternoon, I'm talking to North America, Central America, et cetera. And I ask them, I say, look, you know, I'm coming from the American perspective. So explain again how new regulations can come through and what can IHF do to fill the gap with knowledge exchange or whatever. So it's okay. I think it's okay to do that. So if you want to go international, you need to be comfortable with that and accept it. And you'll be surprised on how well that works. So I did a similar discussion for the ACHE Congress this March. And actually, Linda Clark, who spoke to you a couple months ago, was actually one of the speakers. And I had 4 of my friends that ran hospitals in the United States and also ran hospitals internationally. So they had great perspective. And we all talked about what are the leadership competencies that need to be in the top shape, right? Need to be in the top drawer of your chest of drawers of skills. Absolutely communication, because you're going to be talking to people that English most likely is not their first language. You need to be someone who really just doesn't say continuous learning, but actually will do it and does it. If that's not your shtick, if that's not your thing, then moving internationally will be a struggle for you, because you're going to have to learn. You're going to have to learn the basics of activities that you've known for years because you grew up in the US system. So if you don't like learning something new, then moving internationally and working internationally is probably not the best career choice. And then all about back to flexibility or agility. You gotta be flexible. You gotta be able to go with the punches, know that you don't know everything. It's an interesting and rewarding experience for the whole family. When I used to recruit executives to the Middle East, so I was running Corniche Hospital, so I recruited the chief medical officer and all those some high level positions. It was super important to make sure that the whole family was aligned with this, for the obvious reasons, and because it's a no-go if you think you can do an international assignment and not have the full commitment of your partner, your family, etc. All right. Last slide with a visual aid. So how do you do it? Okay, my advice, and similar to like Linda's that gave a speech a couple of months ago, she said, reach out to the American institutions that are doing global work. Okay, not hard, Methodist, Cleveland Clinic, Hopkins, Mayo, Henry Ford, Cedar Sinai. Okay, you get the story. You can look them up. And here are, in no particular order, I think it's alphabetical order actually, are the global search firms that have jobs posted, and I think are pretty good. This is not an exhaustive list. This is the list that I've known for the last whatever years that I've been international or moving back and forth. My suggestion is, if you're truly interested in working internationally, you got to, build your plan, work your plan, get to know these these organizations, look at their job postings, get to know some of the partners or executives in these search firms that do the global search. Do your homework. Something will come up, something will pop up that will be interesting. Get on their radar, right? And if you do that, you'll have greater chances to hear about jobs. All right, that was interesting, and I hope interesting, I should say. I'm going to stop sharing. Let's see if I can figure that out. There we go. I can see lots of names, no faces. Hopefully people are having their lunch, and I'll turn it over to, I believe, who am I turning it over to?
To me, Bruce.
All right, Bruce, thank you very much.
Sure thing, Ron.
Shoot
go ahead.
questions. No, I was just going to say, let's put the hard questions together.
Yeah, we've got several questions in chat right now, and I'd like to remind everyone, if you have a question, to ask it in chat, or feel free to unmute yourself and ask your question directly. So one question, first question, do you need a second language to work internationally?
Ooh, great question. Well, it certainly helps. So now, everybody on this call speaks English. I pretty much can guarantee that. You might know I have other languages, and English might not even be your first language, but I can guarantee you, I can see it. 41 people here speak English on this call. That's good. You're lucky you, because for the most part, English is a very used language, certainly in business, but also in the global world. So English is the language of IHF. It was also the language of the hospitals that we were running, that I was running in the Middle East. And so English helps. It does absolutely help with your assimilation. It helps with your credibility if you know a foreign language, especially foreign language in the country that you're going to. If you have a second foreign language and you want to work in the NGO space, it's French. You know, for our French speakers, there's lots of work that's being done globally in NGO space that's in French and English. So that's a good one. But no, you don't need to have it, but it does certainly help.
Great. Do international healthcare organizations pay a differential for increased housing costs?
Oh, that's a great question. So it all depends. Okay, now I'm going to give you my experience. Most likely my experience is probably the norm, but just it's a data point of one. So when you go international with an American firm, usually there's an international package. They call it an expat package. So when I went across with Hopkins, I had my salary, I had a housing allowance, and I had international packages. When I worked for Al Noor Hospital Group, that's the hospital group in the UAE, I became a local hire, and I didn't have that. I had my salary and benefits, and then you pay for your own housing. So it does depend. US companies that are doing work globally will usually have expat packages, but here's where I talked about flexibility. If you are really motivated to work internationally and you said, okay, I'm going to call the 10 organizations in the US that do most of the international work, and they don't have anything for you, and you say, okay, fine. Well, then you're missing opportunities. I worked at Al Noor, not a US. IHF, my current role, not a US based. So there's lots of jobs out there and opportunities that are not US based.
Great.
Hopefully that answers that.
Yeah, thanks. Another question for you. How are international hospitals governed, and is the board appointed, elected, or what?
Well, okay, so the short answer is it all depends. So what the really neat part of my job is, I am learning, and in some cases quite deeply, the healthcare delivery systems of the countries around the globe, or at least our members, I should say. We have about 50 countries, and so I'm learning those 50 countries' delivery systems. Most of the hospitals globally will have board structures, community boards, or appointed boards through elected officials. So there is oversight and governance. That's pretty standard. Not exclusively, but it's pretty standard. So they will come with boards and governance. However, there are many systems that are governed through, in most of the hospital care, is through the ministries of health. So they don't have a kind of a US model. They'll have a model where most of the resources to provide healthcare is coming from a government or a ministry of health. And so then there's not really that community board or board like you would have a Piedmont board or a Wellstar board, because you really have a minister, and then she will have, you know, the breakdown of how they manage it. And that's actually quite a lot of countries around the globe, especially countries that are more in the developing side of things. They don't have necessarily a robust system. So if anybody is like super interested and you want to put me on the spot, you can maybe ask me a specific country. Since I'm talking to you from Switzerland, I'll tell you a little bit about the Swiss system, because otherwise it's too generic of an answer. Swiss system has lots of similarities with the United States. So here they are: private health insurance. I have private health insurance, and it is required. So it's law. It's a mandated private health insurance system. So you buy health insurance like you would from Blue Cross of Florida, Blue Cross of whatever. So that's required. If you can't buy it, then the government steps in and helps you. Then the delivery system That's the finance system, right? So the delivery system is through a mixture of private hospitals, like in the US, or government or communal hospitals. So their assets are like assets of the community. And so the delivery system is also very similar to the US, which you have in Geneva. You have the University of Geneva Hospital, you have a couple other private hospitals, you have another. And so in some ways, they're competing for patients just like we're doing in the US. So it's a very interesting system that has a lot of similarities to the United States. So hopefully you maybe learned a little bit of something about Switzerland. Next question.
Yeah, how do you adapt to new cultures, especially in a leadership position?
Well, I think, what I've experienced is, first of all, you should do your homework. And so you should know the basics when you go into a culture or a situation. And in every culture, I'm not going to go through the globe, but every culture will have some do's and don'ts and cultural norms. And if you want to be a good leader, then you learn those and you try to follow them. The other thing is, again, maybe as I get longer on the tooth or older in my career, I'm very open. I don't know everything, and I'll even say, if I don't follow the norm or if I make a misstep, just tell me. And so I think being honest that you are in a new culture or a culture that's not yours, I think goes a long way. But that should never take away from doing your homework, which is just good old-fashioned advice everybody knows.
Great, thanks. Nellie Miner has a question. She wants to ask you directly. She's going to unmute herself in just a minute. Nellie, you there?
Yes, I am. Can you hear me?
Yep.
Hey, Ron. Hi, I'm Nellie Miner. I'm a registered nurse here in Atlanta, Georgia. So I made the move from working in a hospital setting to working to a global company and consulting. You talked about some of the challenges in transitioning to like US based to global. Another question that I just wanted to get your thoughts about was just, for me, it's just, I'm having a hard time just finding visibility in the virtual world because it's my first time doing so and doing it in a global scale. Do you have any advice for someone like me who's making that transition?
Yeah, I mean, and I'm sure, other people in this call could actually give you some even better advice. I think we're in new territory as leaders with this virtual world, and a lot of the things that we used and took for granted, getting together and building those relationships that help you kind of move your career along, you're going to have to rethink it. And so I don't have any magic answers for that, except to say you're going to have to appreciate that you're going to have to try to make an effort that's different than knowing that you can get together and build that relationship. So everything from actually scheduling time with key folks within your organization, getting them, asking them advice, those types of things, I think you can still do. It's just going to be maybe in a virtual setting. I can tell you, I talk to business leaders across the globe. Business travel, of course, state the obvious, is way down. And the business leaders will still go back to traveling, but not nearly as much. Now, and again, that's very obvious, but I'm talking to people, I mean, literally around the globe. So I'm getting a pretty good sampling. It's going to be a different ballgame. And so I think you and others, Nellie, are going to have to think of the new ways to build those relationships to advance your career. I'm going to throw out Larry Tyler, who is someone who has great knowledge, and I don't want to put Larry on the spot, but maybe he will be happy to have a conversation with you and give you a little bit more specific, helpful advice as you grow your career. And hats off to you to try something different.
Thank you.
Great, thanks, Ron. Another question, what is the best way to get involved in the IHF Young Executive Leader Program? And is there a vision or plan to expand IHF activities in South America?
So two great questions. It was almost like I told you to ask those. So I told you we did 8 things. One of those 8 things was the Young Executive Leadership Program. We go out to the marketplace. It will probably be in January, and we ask for candidates. so December, January, we asked for candidates to apply. So last year we had 80 or 90 people apply. We went through a review process and we picked 35, and then we had attrition of a couple. So it's not highly competitive, but it's competitive. You should look for that by one, looking on our website in December, January, if you're interested in that. Or two, the American Hospital Association is a member. So if you're on the mailing list for the American Hospital Association's newsletters or announcements, when we go out for candidates, our members across the globe will have our advertisement as well. So that's how you get through it. To be totally frank, I forgot what the second question was. Oh, South America. So we lack members in South America, and I recognize that. And I'll tell you, it's probably a mixture of things, but I think language is probably one of the big ones. And so we are going to engage with a Spanish speaker. Of course, not all Latin America speaks Spanish, but most of it does. Portugal and Brazil are already a member, and we have good relationships with Portugal. But the rest of Central and South America is Spanish speaking. And so one of my business objectives for next year is to find the right Spanish speaker who can then, help us mature those relationships. I can tell you one of the hardest hit countries with COVID is Argentina. They're a member now, but they've been, just inundated with COVID and a financial crisis to boot. So, there are places in the world that are truly struggling, and my hat's off to the hospital leaders that are working in those situations. But we did recognize that South America is a deficit. So thank you for somebody for looking at the map and saying we don't have enough members there, because my 25 board members are counting on me to deliver that.
Thanks, Ron. We have time for one more question, and then we'll have to cut over to Trent to close us out. Unfortunately, we weren't able to answer every question. So, Ron, are you open to people contacting you via email?
Yeah, I think my email contacts are in the PowerPoint deck. So yeah, send away.
Awesome.
I'll do what I can to answer them. But yeah, be happy to hear from people. I love Atlanta, and any time to help the American College Atlanta or Georgia chapter is great.
Thanks. Okay, if you were to personally seek out healthcare, for yourself, what country would you prefer for their system of care?
Okay, well, super question. The sophistication of healthcare of services in Europe is going to be equal to the U.S. The U.S. has a fabulous health system, not knocking any of it. Part of it is because of the way the financing structure is created, right? The financing structure in the United States created a lot of money. That a lot of money made a lot of opportunities to make, tremendous advancements and great training and great people and all that stuff. But I would tell you that I would feel very comfortable having my healthcare here in Switzerland, or, I live very close to France, about 1 kilometer from France, or in France, but mostly in Switzerland. I would feel comfortable doing it. And though Corniche Hospital was a maternity hospital, so I wouldn't be a patient there, we did great care as well as in the Middle East. Great.
Thanks, Ron. Any closing thoughts before we switch over to Trent to close?
No, I think I spoke enough. I'll turn it over to your president.
Thanks.
Hey, well, thank you again, Ron. Really just insightful as we expected. And just for the record, you had a really good attendance, one of our best attendance. So I know that was important to you. So great outcome from our team here to show up and really appreciate our membership. Obviously, a topic that was of great interest. And again, I keep saying this, but we've gone international, which is exciting because there's so much to be learned from the different systems of care across the world. And so, and then thank you for your work that you're doing. Again, it's work that's very important, and especially just to put it under the lens of COVID. I'm sure you never imagined how important and how different your work has become in that lens. So. Thank you again, and look forward to continuing a great relationship going forward between us personally and also with GAHE. thanks to the sponsors. Again, can't thank our sponsors enough for helping us to put on events like this. And just really appreciate your support and helping us to fulfill our mission. You'll have an evaluation form for all those on the call today sent out later today, and we really want your feedback. We want to get better at what we do. These virtual sessions have helped us to expand our reach, certainly, as today's a credit to that. But we want to get better, and so we only get better by the feedback you give us. So give us all the good, and certainly give us the constructive feedback that you see. One qualified education credit. I know Ron and I are going to jump online right after this event and sign up for our hour credit, but please make sure you get credit. And again, just want to extend a thank you to Ron for all you do every day, but certainly for taking an hour out of your day to spend with us here at GAHE.
Thank you all. And you guys are international. I put it all over my social postings so people around the globe know about the Georgia chapter.